I'm Dr. Shruti Tegimani. I'm practicing in Hubli from past 8 years, and I have been using Q-switch NDIAC and long pulse NDIAC from past 5 to 6 years in my practice. They were two different machines initially, and now I have taken Picolong, which is a picosecond Q-switch laser and a long pulse laser in the same machine. There is a huge difference between the effect of passive Q-switch and an active Q-switch. Active Q-switch is of course much more efficacious than passive Q-switch. As I told you, I have been using Picolong since a very long time now, almost 2.5 years, which has two modes, that is long pulse and Q-switch. Long pulse is a very good indication for laser hair reduction and leg vein, and Q-switch we can use it for freckles, lentigens and carbon peel, as skin rejuvenation for fine wrinkles, and nevus of ota and in melasma. It has given me a very good result for all the pigmented indications like nevus of ota and melasma and any PIH. I have also seen a huge difference between usage of a passive Q-switch and an active Q-switch. The patient response is very high with passive Q-switch, and any carbon peels done with this laser, the patient satisfaction rate is very high. The whole procedure would last for about 20 minutes, which makes the patient hospital time very less. It would be getting over by 20 minutes. Let me demonstrate on a few indications for you so that it will be an easy understandable way. So here I'll be demonstrating you the usage of the laser. So when you switch on, you have two modes, that is Pico and long pulse. I have a patient for hyperpigmentation today, so I'll be using the picosecond. So we have different wavelengths here, that is 1064 and 532, and we also have pulsed mode wherein we can use that for carbon peel and skin rejuvenation and other things, and also we have Genesis mode. So we will be here using Q-switch 1064 wavelength for hyperpigmentation. The deeper the pigment, we have to keep a little higher energy. So here I'll be using 240 millijoules and with a 5 mm spot size, and frequency I will keep it around 2-3 depending upon your comforts. You cover the patient's eye properly, as well as you wear the protective goggles. So as you can see, he has a hyperpigmented forehead, for which I am using 240 millijoules and with a spot size of 5 mm. So hereby I am starting the laser. Are you okay? Shall I start the procedure? Sure. As you can see, there is a bit of change in the skin tone, which is the indications that you can't increase beyond this energy. And also depending upon the area, if you still want to increase your spot size, you can do that. Also you can increase the frequency if you're confident enough to move faster. You can see a bit of edema that has come on the skin, which is expected. Should ask your patient to take strict sun protection post procedure. The results are seen after 2 to 3 weeks, and a minimum of at least 3 to 4 sittings of these at an interval of 1 to 1.5 months is required. Make sure if you're using a high energy, please do not repeat the areas. So now I'm working on his nose, wherein it's a little hyperpigmented area. I'm keeping my spot size a little higher. The patient should be feeling the heat. If the patient is uncomfortable, that means you have reached the maximum energy. Here I'm using Q-switch mode or melasma. So I have kept an energy of 240 millijoules with 6 mm spot size, and the frequency is 4. Always ask if the patient is comfortable, and the patient should only feel the heat of the procedure. But if the patient is discomfort, so please reduce the energy. As you can see, there is a subtle change in the skin tone,
very mild erythema, that is the end point. Cover the whole area. The energy that you use on both sides might not be the same. It also depends on the depth of the pigment. So if you feel it is not working, you can even go ahead. Always ask if the patient is comfortable.
Here I am using on a tattoo with an energy of 240 and spot size of 5 mm. Keep a larger spot size and see if the color has to disappear and there shouldn't be any frosting. Usually this is a professional tattoo and it's a black ink, so I'm using 1064, and if it is a hand tattoo, which was the conventional tattoos which they used to put in olden days, it might take a few more sessions because there is no precise depth of this.
So this is the end point. You can see the edema as well as the color disappearing. Focus on the pigment and give 1 or maximum 2 shots in one place. You can go along the pigment.
Now saw the tattoo removal in which we did on a professional tattoo. We also can do this on a traditional tattoo like bindi tattoos, but there we might have to do extra sittings because there is no hand precision. And here in a professional tattoo, since it was a black pigment, I used 1064 nanometer wavelength, and in red pigment or in green pigment we can use 532 nanometer. Again, there has to be just the color disappearance, but not too much of frosting. After the tattoo removal laser, we have to put some ice for the patient not to feel the discomfort, as well as it reduces the surrounding tissue damage, and we have to ask the patient to apply any anti-inflammatories like local steroid application like fluticasone or mometasone for about 2 days. And if it is on the face and any sun exposed areas, we can ask them to have a good sun protection with sunscreens, and if they cover the areas, it is much better. So in Indian skin, since it is type 4-5, wherein we can expect some kind of hyperpigmentation if there are energy variations. So always do not go on a higher end. Start with a low energy. If you feel the color is not disappearing, you can always increase it. And keep a larger spot size, and do not keep 2 mm and 3 mm, and because it causes frosting, and there also can be scarring. We also saw that I used Q-switch laser in melasma. In melasma, we have like deep dermal and epidermal melasma. In a deeper indication, we have to use a little smaller spot size with a little high energy. But I would still recommend do not go beyond 4 mm. Do not come below 4 mm. The energy should not increase more than 320 in Indian skin, because there are all chances of PIH, and in fact the patient won't be happy if you give PIH because they have come for melasma indication. And post care, you have to ask them for strict sun protection, as the area has become very sensitive. You have to ask them to apply again steroid cream for about 2 days, and then continue with their anti-pigmentary creams in the night. When you are treating a dermal melasma, be very careful. You do not have to go beyond 240, and with you can just decrease the spot size up to 4 mm. Don't go lesser than this because it might cause PIH. You can do repeated sittings, and there you might take about 4 to 5 or maximum 6 sittings to show the results. And I would ask you to give them a nice photo protection, because it increases the skin would have got sensitive, and you have to ask them to use steroids for 2 days in the night and continue with their depigmenting creams later.